So today we are to talk about hypoxia. In understanding hypoxia, we need to have a quick review over the lesson on the respiratory system. Now, basically, respiratory system has to do with oxygen being transported through the respiratory system to be taken through the blood vessels and to the respective organ. So the oxygen goes through the respiratory pathway, namely the trachea, the bronchoses, and then after that, they get into the lungs, and then inside the alveoli, they get diffused onto their carriers. Their carriers we are talking about here is the red blood cells. And through inside the red blood cells, they are being transported through the vessels, and they are being transported through the vessels to the respective tissue. And inside the tissue, they are used to create energy in the name of ATP. So basically, the tissue level is what we call the tissue respiration, and this level is what we call the external respiration. Now, hypoxia, in other words, just means a decreased amount of oxygen. The decreased amount of oxygen in hypoxia is not only in the blood, but it can also be inside the tissue. So in understanding this concept, I want you to consider this as a cargo that is carrying things or raw materials from point A to point B. Let's say the cargo is carrying the raw materials to the restaurant. So first of all, for if the farmer is not able to produce enough raw materials, then there will be a problem in the delivery. The amount of raw materials that would be provided would be decreased. And in that case, we are talking about hypoxic hypoxia. That is, if there is a decreased amount of decreased amount of oxygen in the environment. For example, when we go to higher altitudes or when we're in a garage where there is carbon monoxide intoxication. So whenever there is a decreased oxygen amount in the environment, we call that hypoxic hypoxia. The next phase is maybe, unfortunately, though he had the raw materials, but then he couldn't plant them as it's supposed to be, or he couldn't take them out to the roadside where they would be picked by the cargoes. The cargoes I'm talking about are the red blood cells. So if he cannot take it out because of several reasons, one of the reasons can be that the road to his compound might have been blocked. So in that case, we are talking about respiratory hypoxia. So respiratory hypoxia is when there is a problem with the respiratory system causing a decrease in the intake of oxygen. It can be one of the following. Maybe the pathway here is being blocked or is reduced. The airway is being reduced. A good example is what we see in chronic obstructive pulmonary diseases, bronchitis, COPDs, and the others. Or even if a tumor cell is compressing the respiratory pathway and making the lumen very small. Again, that would be a respiratory hypoxia. Another example could be that maybe his walls are so thick or his gates are so thick that the farmer cannot go out and put it outside for the cargo to pick it up. And that is when we have fibrosis. So if in case the lumen or the lung itself, the alveoli have a problem, that a good example is in fibrosis, there will be a problem with oxygen diffusion. So when there is a problem with oxygen diffusion, that again can lead to hypoxia. Now, let's say all this is normal. So again, the problem with the respiratory system collectively is what we call the respiratory hypoxia. Let's say the problem is not with this, and the problem has to do with maybe the cargo didn't even come to pick up the things, or the cargoes he needs 10 but only 5 came, which means that they could only carry a little amount or a little quantity of the raw materials that he brought. And in that case, we are talking about hemic hypoxia. Other word, hemic hypoxia or blood hypoxia, meaning the oxygen cannot be carried by enough red blood cells. And a good example is when someone has anemia. So if there is anemia, it means that the carriers of the oxygen are less. So that can lead to a hypoxia. So that would be again, hemic hypoxia. The next type of hypoxia is when there is a circulatory hypoxia. Let's say for some reason, the road that the driver has to drive on after he carries the raw material is being blocked for some reason. Let's say this is blocked. Example, in cases where we see injuries and all the others, we do have a hypoxia, and this hypoxia is called circulatory hypoxia. So anything that has to do with the circulatory system, a problem with the heart, or a problem with the vessels, an injury of the vessel, whatever the problem is, if it is impeding oxygen from traveling, then that would be a level of hypoxia, and that we call a circulatory hypoxia. The final one, but not the least, is the tissue hypoxia. Let's say he got the raw materials to the restaurant, but the restaurant was closed, or the chef was not there to use the raw materials to make food. If that is the case, then that can again lead to, we call that as well a hypoxia. And the hypoxia in this case is called tissue hypoxia. So a tissue hypoxia is normally seen when there is a problem with the tissue itself. This is normally seen in cyanide poisoning, where cytochrome oxidase is being blocked, and it does not, and for that reason, we cannot use the oxygen to produce energy. So that would be what? That exactly would be a tissue hypoxia. So let's look at the next slide and understand what we mean. So here are your keys for that. Hypoxic hypoxia is when there is a decreased oxygen availability in the environment. We see that in high altitudes. In high altitude, what is happening? The partial pressure of oxygen is low. In carbon monoxide toxins as well, especially someone in a garage, and then you come and meet them, they've passed away, and the fumes from the garage is coming so much. It's all because there is not enough oxygen inside the garage, because red blood cells have more affinity for carbon monoxide. Next would be the respiratory hypoxia, where we see whenever there's a problem with the respiratory system. Example, in obstructive diseases or in pulmonary fibrosis. Hemic hypoxia, we spoke about anemia, and circulatory hypoxia, injured blood vessel or blocked vessel, or any problem with the heart failure, or whatever the case will be. If there is an impedance in the travel on the road for whatever reason, that would lead to a level of hypoxia. And then finally, we do have a tissue hypoxia, which we see a problem with the factory itself. So that would be cyanide poisoning. Let's look at a quick question under it. A patient measurement of the arterial blood pressure, partial pressure of carbon dioxide, and partial pressure of oxygen during an attack of bronchial asthma. What is bronchial asthma? It's a kind of respiratory obstructive disease. Revealed a hypocapnia and a hypoxemia respectively. What kind of hypoxia is this? This hypoxia would be, you got it right, a circulatory hypoxia, because there is a problem with oxygen being diffused into the lungs to the next stage. So yes, thank you very much, and subscribe to our channel.